So good morning, afternoon, or evening for everyone joining us. Welcome to today's Asia-Pacific Stats Café session. We have a few more people connecting, but I say that we get started now since we only have 1 hour scheduled for the session today. So my name is Nicholas Patuanamel, and I work with the ESCAP CRVS team, and I will be moderating the session for today. So the session's topic today is on the importance of generating CRVS evidence for better policy and CRVS system improvement. So we have a fantastic lineup of speakers for today. So from our CRVS team at ESCAP, but also from our colleagues at our DRC and from our colleagues at the Fiji Bureau of Statistics. And so before we hear from them, I do have a few housekeeping rules to announce for this session. So throughout the meeting, I ask that everyone to keep yourself muted throughout the session. If you have any questions, we will have time allocated for Q&A at the end of all the presentations. So if you have any questions in the meantime, please write them down in the chat, mentioning to whom the question is directed to, and we will make sure to address them once all of the speakers have presented or throughout the session in the chat box. So without further ado, let's get started. So our first speaker for today is Tanya Seyerson. Tanya is a statistician and CRVS lead at ESCAP Statistics Division. And Tanya has conducted research on citizenship legislation and various aspects of CRVS. And she's been supporting ESCAP CRVS activities since 2013. So yeah, Tanya, thank you for joining us for this session today. And over to you.
Thank you so much, Nicholas. And it's really great that we're having this Stats Cafe today. So ESCAP obviously has been supporting CRVS activities in the region for quite a while. And actually, let me see if I can switch to the next slide here. Since 2014, our work has really been guided by the agreements made in the region on the CRVS decade. And as most of you probably know, that decade has now been extended until 2030. But what maybe some of you don't know is that already back in 2014, when we initiated this work, there was a research agenda for CRVS developed in order to really highlight the importance of research for improving CRVS systems across the region. And I think Nicola will talk a little bit more about this research agenda later. But the importance of research for improving systems have really been at the forefront of our work for many years. But only over the last few years, we have really managed to dig more into this. And I'm really happy that we're having this Stats Cafe today, where we will focus even more on the importance of research for improving CRVS systems. Just a little bit of an overview of the kind of work we do at ESCAP to support countries. So one of the areas of work is about CRVS inequality assessments, where we basically try to identify who are the ones who are not registered in the countries. And obviously this is also evidence generating. And I think Melly from Fiji will talk a little bit about some work related to this. We also support countries in another way, which is supporting the production of vital statistics based on civil registration records. And again, here we have publications and so on from many countries across the region now. And this is really one of the areas where we've seen significant improvements over the CRVS decade. Another way we support the generation of evidence and policy impacts is through mapping business processes across the countries. Basically looking at how registration processes can be improved, both to streamline for the government aspects, but also for the recipients, the clients, or the families, whatever we call the people who are benefiting from CRVS systems in the countries. And then we have this other large area of work, which we kind of overall label as evidence to action. This is where our research initiatives come in, that I think Nicola will talk a bit more later. Here's the CRVS Applied Research Training. and also the CRVS Research Forum kind of comes under this. And in addition to this, we do support quite a few knowledge products trying to highlight what CRVS looks like across our region, provide guidance on different issues and so on. So a lot of this is not necessarily what we would call academic research, but it is building on the evidence available to countries to improve systems. So that is kind of the overall things we're doing from our side, but much more important and interesting is what is happening in countries and amongst our partners. So I will give the floor back to Nicholas to introduce our next speaker. Thank you.
Thank you so much, Tanya, for kicking things off and for this nice overview of our evidence-generating activities here at ESCAP. Just a quick note that all of the resources that Tanya has mentioned and all of our CRVS knowledge products and more information about the decade is available on our website at getinthepicture.org. So do have a look if you're interested after a session. And thanks again, Tanya, for this really nice overview of ESCAP's work and highlighting why we're so interested in supporting the generation of CRVS-related evidence. So our next speaker is Sana Nafa from IDRC. Let me take control. Give me a second to switch off the slides. Okay. Yes, thank you. So our next speaker is Sana Nafa from IDRC. And Sana Nafa is a senior program specialist at Canada's International Development Research Centre. Sana has over 20 years of experience in public health and systems training, and she has notably led some initiatives like pandemic preparedness for the UN, and has also previously held some senior roles at WHO and UNAIDS. So Sana specializes in designing and implementing research programs, so we are very glad to have her present to the session today. So unfortunately, it's very late here in Canada, so Sana has prepared a recording of her presentation, so please bear with us while we get the video ready. Yui, can you confirm if we see things clearly on your side?
Hello, everyone. Good morning, good afternoon, colleagues and distinguished participants. On behalf of the International Development Research Center, it's a pleasure to join you today. I would like to begin by extending my sincere thanks to ESCAP for convening this important dialogue and for its continued leadership in advancing CRVS in Asia and the Pacific region. Today's discussion is timely and necessary. We at IDRC, we believe that evidence matters because it transforms intentions into impact. IDRC strategy between 2020 and 2030 aims at building a more sustainable and inclusive world. The strategy has 3 pillars. The first one is to invest in high-quality research and innovation in developing countries. The second one is to share knowledge for greater uptake and use, and the third is to mobilize alliances for impact. Why we invest in CRVS? CRVS systems are reliable resources. and data for policymaking, resource allocation. It promotes equity and visibility, and so that no one is left behind. It strengthens governance and crisis response and support monitoring SDGs and improve the functionality and efficiency of CRVS systems through innovative use of technology and legal review for data protection and confidentiality. The history. The Center of Excellence for Civil Registration and Vital Statistics was established in 2015 by IDRC and with the support of Global Affairs Canada to address the persistent gaps in civil registration and vital statistics systems worldwide. In August 2021, the center transitioned to UNFPA to expand its global reach and network. Why evidence matters? Evidence is important for providing accurate data-driven policies and for resource allocation, policy making within countries to identify gaps and solutions, the bottlenecks and blind spots to improve the CRVS system, to improve the inclusivity and sustainability that meet population needs, and to promote human rights. For example, in Malawi, the team there worked on birth and death combined with geospatial and health system data to identify coverage gaps, inform national strategies, and influence the national policies for funding decisions and health integration systems. CRVS systems are good resources to show the gender bias in data quality, to show the barriers in social norms, legal frameworks, and to also support the need for data by sex, age, marital status, and location, and to also support designing and implementing gender-sensitive CRVS reforms and policies for more equitable representation. For example, in Tunisia, they noticed discrepancies between death certificates between men and women, especially in maternal death in rural areas. And this had encouraged the policy to change and focus on certification standards and accountability in these areas for better health outcomes and better reporting. Behavioral and demand side, this is very important to understand why under registration in some areas and communities, which is linked to the social norms, the fears, the perceptions, so that governments can adapt more outreach and communication strategies and incorporate the behavior research, ensure CRVS reforms are user-centered and more effective. In Ghana, for example, CRVS data indicated that hypertension is one of the causes of death, highest causes of death or leading causes of death. So they improved the primary health care management for hypertension. And also CRVS data showed that a quarter of births in 4 regions were unattended by skilled birth attendants. So they developed a program and deployed midwives who are trained in these risk areas. Another good example in Kenya, where they linked the birth certificate with the enrollment in basic education and early childhood education. So schools were part of birth certification reporting and making the links to the education system that was decentralized all over many areas in the country. Integrating CRVS system within data systems like health information system, census information, surveillance system, district health information system. This is very important nowadays with the lack of data due to like DHS is not available for all countries now. So broader integration and benefits can be improved by governments when data is more becoming a good resource for policy making in the countries. What are the areas for strengthening problem-driven applied research, targeting research where bottlenecks and blind spots are? So better policies are developed. The co-production with governments and national and institutions can help to reform and ensure effective implementation. And also community of practice, peer learning at country level, at regional level, and between countries is very important, and to focus on the neglected areas such as the gender and the humanitarian response. Key takeaways and future directions. Using high quality context specific evidence is essential for effective CRVS reforms. Embedding evidence into policies and institutional practices will help governments sustain and improve CRVS systems over time, and ongoing research, capacity building, and data integration ensure CRVS system remains adaptable and relevant from societal changes. You can contact me at this email and for any questions and clarifications. And thank you so much for the invitation and for listening. Thank you.
So our apologies for the technical issues playing the recording at the start, but we got there in the end. So thanks to our colleague Lepacorn. So thank you, for your support. And also huge thanks to Sana Nafa for her video presentation. So if you have any questions or comments for Sana about her presentation, please write them down in the chat and we'll make sure to forward them to her, or you can simply send her an email at the one that she provided at the end of her presentation. So our next speaker joining us from Fiji is Meli Nandakuka. Meli manages the Social Statistical Division at the Fiji National Bureau of Statistics, producing vital socioeconomic indicators for national policy. He plays a key role on Fiji's Civil Registration and Vital Statistics Committee, and he is really committed to driving improvements through the National CRVS Action Plan. So Meli has worked on several projects with ESCAP on generating evidence for Fiji's CRVS system. So Meli, thank you for joining us today, and over to you.
Thank you, Nicholas, for that short introduction. Thank you. First, I'd like to take this time to thank the ESCAP team for the invitation on this particular area. As for Fiji, on the work that we have been doing with the ESCAP team, a few of the projects that Tanya has mentioned in her presentation, and out of those BPI projects and some of the other projects that we have done, which has led to this project which I'm going to present on today, on the identification of priority geographic areas for targeted interventions to reduce gender inequalities in on-time birth registration. In Fiji, next please. We have a strong Fiji CRVS committee, and part of the stakeholders are, as you can see, most of the government ministries and also the stakeholders that are part of the CRVS team, and which we include in most of our workshops and trainings. Next, please. So in this project, the method that we followed that in April 2025, following the standardization of the place of birth registration from the Ministry of Justice or the BDM data, the variable of analysis of on-time birth registration by individual registry officers was taken. So this data set was used for analysis, which extracted from the National Birth Registration Database, as I've mentioned on that particular date. And the total number of birth registration records extracted, as you can see on the table below, from years 2015 to 2024. Next, please. On this administrative data and from the Ministry of Justice, we have recently undertaken analysis of on-time birth registration by gender disaggregations, including the sex of the child, the maternal age, and marital status, and identified the presence of gender inequities. And to date, the understanding the magnitude of these inequities by geographic location has not been possible due to the lack of standardized geographic variables in the National Birth Registration Database. So therefore, standardization of these variables has enabled the analysis of on-time birth registration disaggregated by the place of birth registration, that is the registry office, in order to identify the priority geographic areas that could be prioritized for targeted and gender-sensitive birth registration awareness campaigns and outreach programs. Next, please. So from this project, the findings which we had is there was a large variation across civil registry offices in Fiji in the total number of birth registrations that were completed for children born during those periods from 2015 to 2024. And we've seen the timeliness of those birth registrations with respect to the average number of days between a child's date of birth, which should be the proportion of births that were registered on time, which is less than 365 days. And also the largest number of birth registrations for children born during 2015 to 2024 were at Suva Registry. As you can see, the percentage and the numbers that is there from all those different registry across the nation. Next, please. So as you can see here, this table, the 10 registry offices with the longest delays in birth registrations were also the ones with the lowest rates of on-time birth registration. Although their rankings varied slightly depending on the measurement used, which is the average days versus the on-time rate, these offices consistently perform the poorest in terms of timeliness. So the geographic distribution of these 10 offices were fairly balanced across Fiji's divisions. That is the Northern Division, as you can see, 3 registries, Eastern Division, also 3 registries, Central Division, and also 3 registries, and in the Western Division, which is only 1. So these 10 offices accounted for 10.8%, which is 17,073 of all birth registrations for all children that were born between 2015 and 2024. Next, please. So the 10 registry offices with the largest average number of days between the birth and birth registration were the same 10 registry offices that had the lowest proportion of on-time birth registration. There was a small variation, however, in the ranking of 1 to 10 across the 2 different measures of birth registration timeliness. The ranking is based on the average mean days to birth registration, which is a more precise measure of the timeliness than the binary categorization of on-time registration. Next, please. The 10 registry officers with the largest delays in birth did not show any significant disparities in birth registration by sex of the child. In other words, there were no significant differences. That is around 95% confidence interval were overlapping in the timeliness of birth registration between male and female children in each of the 10 registry offices. Next, please. Thank you. Among the 10 registry offices with the largest delays in birth registration, almost all registries show that single mothers had a larger delays in birth registration compared to married mothers. So with the difference significant, not overlapping 95% CI in 6 of the 9 registries. The only registry where delays in birth registrations were greater in married mothers was Lakamba registry. However, the difference was not significant and was based on very small numbers. Next, please. So as you can see, some of the key findings and gender-specific barriers to on-time birth registration leading to policy is that the geographical and access barriers, which has long travel distances from rural, highland, and maritime communities, the limited transport availability for mothers relying on home deliveries with no direct connection to registry offices. The knowledge and awareness gaps, there is limited understanding of importance and the process of on-time registration, the lack of community awareness campaigns in both rural and urban areas. As for cultural and traditional influences, for Fiji, the cultural naming practices delaying formal registration, that is the traditional norms prioritizing customs of official processes. And also for some have financial barriers, the cost of transport, ID documents and reprints, late registration penalties. For example, it's around $34.50. Mothers are unable to afford the printing of notification of birth forms, leading to some other documentation challenges, missing or lost NOB on notification of birth forms. The mothers are lacking valid identification, additional requirements for single, young, or widowed mothers. Social and institutional stigma, teen and single mothers delaying registration due to fear and judgment, compounded by additional documentary requirements. Next, please. So some of the recommendations and key highlights on that: expand awareness programs across rural and urban areas, prioritize locations with longest registration delays, stronger collaboration with the Ministry of Itoke Affairs. It is a joint engagement to understand the cultural and community-based barriers, improve support structures for Itoke mothers. Awareness in child health clinics, display awareness banners in childhood wellness immunization clinics, avoid additional workload on health staff. Strengthening hospital-based registration by prioritizing establishment of registration desks in major hospitals, improving the linkages between the Ministry of Health and the Ministry of Justice. Mobile registration services, deploying of mobile teams to identify high delay regions, and also target remote and hard to reach villages and settlements. Lastly, on the digital transformation, to support the development of online and mobile registration platforms, which also lead to ensuring equitable access for rural and low connectivity communities. So most of these recommendations that I've mentioned, these policies has also been addressed, and we're glad that most of these recommendations have been addressed thanks to the support from Vital Strategies and ESCAP. Lastly, our overall highlight, the consultations clearly show that gender, geography, financial capacity, cultural norms, and institutional process all intersect to create delays in birth registration, and addressing these barriers requires multi-sectoral collaboration, targeted community outreach, and a strengthened Ministry of Health, Medical Services, and Ministry of Justice integrated system. So here are some of the pictures that we have. Our CRVS committee has actually addressed some of these issues that has been, so some of the findings from this project, and we are glad that we are able to address them. So having this research on CRVS and these findings will be able to address the gaps that are currently in place, and we are glad that the CRVS research on Fiji's dataset, national birth registration dataset, we were able to find these gaps and address them. So from Fiji, we say Vinakavalevu to you all. Over to you.
Thank you, Meli. Thank you, Meli, for your presentation and for sharing Fiji's experience, findings, and insights with us. I think it's clear how you really highlighted how evidence can play a key role in identifying priorities for targeted interventions of a CRVS system. And I think the examples that you highlighted, I think really complements nicely, Sana's presentation, where she mentions the use of CRVS evidence, but, being used for things like education or health intervention. But, your example really highlights how evidence generated from CRVS systems can actually aim to identify issues and improve the CRVS system itself. So, looking at timeliness and gender disparities in registration practices, for example. So yeah, that's super interesting. And, thanks again, Meli, for your presentation, and good luck to Fiji in their mission to address the barriers to registration that you've mentioned. Our final speaker for today is Nicola Richards. So Nicola also works with the CRVS team at ESCAP and has been leading many of our CRVS research activities. So Nicola has over 15 years of experience working in the field of CRVS and health information systems. So we're very happy to have her with us for this session today. So Nicola, thank you for joining us, and over to you.
All right, thank you, Nicholas. We've got the duo here, the double Nicholas for you all. All right, so I think that's a really nice intro for me. We've had a great reflections from one of our partners from SANA, and then also some fantastic examples from Meli and the on-the-ground work in Fiji. So I want to put it all to you. Does evidence matter? And you'll probably guess that we already know the answer to this, but we can see here that there has been a really substantial growth in the number of academic papers on CRVS over the last, from 1990. But, was this by choice? Was this by chance? And what role, if anything, does research, really play in system strengthening? Well, of course, as you probably guessed, it definitely wasn't by chance. It was very much on purpose. And Tanya mentioned this as well at the start, but there's really been two quite critical think pieces around developing the research agenda for CRVS. So one of them was developed by Carla Abuzar and others in 2014, and this looked at developing the research agenda for CRVS in Asia and the Pacific. And then also what Tanya mentioned, in 2018, ESCAP put out another document on the role of research in strengthening systems, and I've got the links to those documents there. But essentially the arguments of these two papers were, just the importance of research for generating knowledge, for enabling practitioners to really filter and make sense of different information, and how research is really core to underpinning effective action. And I think Meli's example of the work that was just done in Fiji was a great example of that. But research, is also really important in terms of identifying what questions we should be looking at. How do we develop the evidence base for interventions that work and perhaps that don't work so well? We need evidence that can be both locally relevant, but also of broader regional and international utility. And this is sometimes where we find some challenges in terms of how do we translate our country-specific learnings into broader learnings for other countries. And finally, research can really help identify ways of overcoming these barriers and bottlenecks and contribute to creating these shared resources. So, does research matter? Yes, it does. And a few people have already commented on this. I think Sana touched on this, but, and Melly certainly as well in his, but one around equity issues. So, research helps countries confidently and transparently determine what interventions are working, but also in which kind of settings. And this is really important because we know that when we are setting our priorities, we need to understand the variance in our subnational areas, and are there certain groups that are getting missed out or a little bit left behind, and how can we do better to target those. We also know that the success of improving CRVS systems really depends on the ability of our policymakers to bring all of this information together and guide their policy and program choices. So we need to, again, know what works well in what kind of settings, and how we can adapt that to our local circumstances. And the final one here around methods, research helps make our CRVS intervention sustainable, cost effective. Lessons learned from other countries and contexts are really important to this. And again, this is where it can be a bit tricky because we're often really good at sharing our success stories, but perhaps not so much where things didn't work so well. But that is another really important area in terms of, helping other countries move ahead and develop their systems. And so I want to put this out there to everyone that's on the call that we are all researchers and, really trying to broaden our thinking around this to say that research isn't confined to academia, and really anyone engaged in these different aspects of civil registration and vital statistics can contribute. And this is because, research isn't just about the kind of formal scientific methods that we often think about first, but it really covers a wide range of different things like our operational and our implementation research, which Melly kind of touched on with his, and this is often what is most important to our policymakers, right? That's what they're interested in learning. And so because research can cover this use of evidence and knowledge to influence policy and programming and planning, that's why it is so important in terms of both a local aspect, but then also the potential global impact of it. So what are we at ESCAP doing to promote research? Well, along with this Stats Cafe, we've done a lot of things because, as Tanya mentioned, we really believe that documenting lessons learned and country experiences in CRVS, that should be documented and it should be shared. We should be compiling our findings, we should interpret them and really make them readily available to users for policy programming and practice, but also on a much broader scale perhaps than maybe what we have done. So where did it start? In 2023, we held the first Asia-Pacific CRVS Research Forum, and this was a major research, information sharing, capacity building and networking opportunity. We had over 390 people attend over I can't remember now, 2 or 3 days. And this was really impressive. It was the first time that we'd held this type of event. We weren't sure how much interest we would get. And it was also all done online. We were still coming out of our post-COVID lockdown world. So we were blown away by the interest in the forum, both in terms of people who presented and then also our participants. And all of the resources from this are available online. One thing that the Research Forum did really highlight to us at ESCAP, though, was this shortage of research capacity among our CRVS practitioners. And so that led us to the CRVS Applied Research Training Initiative, or what we call the CART. And so the CART was launched in 2024, and we've just had our third cohort start this year, which is fantastic. And it's really about facilitating the improvement of CRVS systems through applied research and evidence-based intervention. So we give our CART participants access to a range of online training modules that are available online that kind of go through core research topics. We match our participants up with mentors to provide specific technical expertise along the way. We do have a series of deliverables, or like little assignments, and these are designed to build on each other to take participants through the research development, implementation, and then publication process. We have 2 face-to-face workshops, and you can see some of the photos from those events. And we also have a growing alumni network, and I actually saw a couple of ex-CART participants on the chat list. So lovely to see you guys still involved. It is a joint initiative between ESCAP and also ECA, our colleagues from Africa. And this, again, is really in recognition of the fact that we learn faster and better, you know, when we share learnings across regions, and that our CRVS challenges, you know, they're often quite similar, even though the context might be quite different. But, you know, these shared commonalities is what's really helpful in thinking of developing, you know, creative solutions, or, you know, sharing what's worked here and what hasn't. And, you know, this diversity is really unique in our third cohort. We've got participants from Seychelles, Kiribati, Nauru, Namibia, Kazakhstan, Kenya, Indonesia, and India. So we've got this really nice diversity, which is really important in terms of sharing these learnings and making sure that the research has this local impact and global spread. Which leads us now to the 2026 Research Forum. So again, in partnership with ECA, we've gone global. At the moment, we've had 159 abstracts submitted from over 40 countries. And again, an amazing spread: Mongolia, Bangladesh, Ghana, Timor-Leste, Vietnam, Uganda, lots more in between. We are very busy right now with reviewing papers, but what I've put up here is a little sneak peek of the program for you all. So at the moment, we've got kind of 6 key themes that are going to be spread out over 3 days. And you can see some of the, what would we say, our standard, you know, kind of themes around barriers to registration and some innovations and digitization. But what we were also really impressed by this year was some of the really strong research that's coming through around issues like equity, again, which Melly touched on, and also more around the production of vital statistics. So it's going to be a really packed 3 days, which is absolutely fantastic. So a little call to action here for those of you that haven't already, or perhaps if this is the first time you've heard about the forum, I really encourage you to sign up. You'll be able to hear from other CRVS practitioners. You might get some ideas for your own research. You'll certainly learn what's happening in terms of CRVS in Asia and the Pacific, but also Africa and beyond. You might be able to identify some gaps in the current research agenda. You'll definitely be able to link up with others. So it will be a fantastic 3 days. It's being held in Bangkok, but we're also running it online as well for those who can't attend in person. We'll put the link in the chat as well for those that want a little bit more information about it. But we really do encourage you know, people to attend these events and really start to boost this cohort that we've got of CRVS practitioners from around the world. So with that, I will say thank you and hand it back to Nicholas.
Thank you, Nicola. So this is all really exciting stuff. So I invite everyone to go on our website on getintopicture.org, where you can not only register to attend the research forum, but learn more about our other research initiatives like the CART. So, throughout Nicolas' presentation, our colleague Ankana has been hard at work sharing all of the links to what Nicolas was talking about. So, this is a pretty handy way of looking at all these resources. So please do go and look at our website and, register for the CRVS Research Forum if you can make it. So thank you again, Nicolas, for your presentation. And now we do have about something like 10-ish minutes for time allocated for Q&A. So if you have any questions, you can either write them down in the chat or use the raise hand function. I don't think we have any questions in the chat for now. Do any of our speakers maybe have a question?
I can ask something. Well, I've still got my camera and microphone on. And this
Go ahead, Nicola.
I do have a question for Melly, but I've also got a question for everyone that's listening, and maybe you could put your answers in the chat. I'd really like to understand from those people that are listening in today, what type of support would you think would be helpful to help transition you into doing perhaps some research with your job? Or maybe if we flip it the other way and say, what barriers and challenges do you feel that you currently face, if you maybe you're interested in doing a research project, but haven't been able to get started yet? So if you've got some ideas in the chat, I would absolutely love to have a little bit of a brainstorm session about that. And then while you're doing that, I've also got a question for Melly. So Melly, I'm going to pick on you because I know you and you did a great presentation. You spoke a little bit about dissemination, but I'd really like to understand a little bit more perhaps around how you have disseminated your work, or perhaps any plans to disseminate it. As you were speaking, I really picked out on quite a few different potential messages that came from the work, right? There was things around policy, but there were also important community messages. You had the messages around equity and the differences there. So again, for you, I'd like to understand, what you have done, what you'd like to do, and if you have any reflections as well on support that might help an institution like, the Bureau of Stats to kind of move a little bit more into this research space. Melly.
Naka, Nicola, and thank you for the great presentation. Yes, thank you. For dissemination-wise, for PG, we had published an analytical report out of that project, and also a policy brief that was part of the dissemination. And you can find both of these reports and the policy brief on our website. And for now, with the committee, we are working on also getting this tabled to Parliament, so that through our CRVS committee and our CRVS chair, which is the Minister for Justice. So we would like to hear more about if there are any other dissemination that is there, especially for the key messages that, like you have mentioned, on community-based, which is something that we are working towards in getting these key messages out to the public, especially getting it down to the lowest, at least primary school level, for them to understand our messages. Thank you, Nicola, for the question.
It's a great answer, Melly. So we also have a question from Petra Namias to any speakers, asking why do some CRVS research findings leads to system reforms, as happen in Fiji, while other research findings may not result in any system reforms. So this is a question for any of our speakers, but while we think, I think somebody had raised their hands. I think it's gone down now. Oh yes, Mehdi. You can unmute yourself and ask your question if you want.
Thank you, Nicholas. Can you hear me?
Yes, loud and clear.
I'm from Bangladesh. I'm Assistant Registrar General, Birth and Death Registration Office. You know that we are working two component of CRVS, that birth and death registration, our marriage and divorce registration procedure is going on. So I have a basically it is not question, but it is my process of learning that last year we have registered more than 10 million birth registration and about 1 million death registration. So we didn't still have any statistical report from this process. So it will be very much helpful for me that if any research or any procedure that how to generate CRVS statistics from this birth and death registration data, it will be helpful for us for the coming year to generate vital statistics. Thank you.
Thank you very much for sharing this with us, Mehdi. Does any of our speakers want to comment on this? If not, I do kind of want to build on Petra's question in the chat about how some of the findings may be transformed into evidence, while some others, some of the findings have been transformed into actionable policy, while some others didn't. And I think, Millie's presentation, during your presentation, Millie, you mentioned that some of the disparities have been addressed in Fiji, or some of the barriers have been addressed in Fiji. But I was wondering maybe if you could quickly go over some of the process of how these findings have been transformed into, policy or systemic change in Fiji. What was like kind of the political process through it? I know that Fiji has a CRVS committee. Do you feel that that has helped on maybe transforming the evidence into impactful policy? So if you could comment on that, Millie.
Thank you, Nicholas. Indeed, for us, what I could say, we have an active committee. So most of these issues have been elaborated and discussed during our committee meetings, and all these findings have been presented first to the committee, and at the same time we find ways to address them. So I believe that is one of the advantages that we have in addressing these key gaps. So, for example, for the mobile registration that I've mentioned, straight after these findings, as part of the project, we had out from July to November last year. The team went out throughout the priority areas that were identified in the findings, and we went out and did mobile birth registrations at these priority areas that were identified. So yes, that is indeed one of the key collaboration with their stakeholders and the findings. So all this evidence does matter in addressing these key issues. Punaka.
Thank you very much, Millie. And I think one last question, and I think it's also directed to you. So it's a question from Hafsa Batul. Their question is about the administrative data digitization challenges in Fiji regarding CRVS. I think, do you have anything you want to comment on, some of the issues with digitization, Millie?
Yes, thank you, Hafsa, for the great question. And as you know, Fiji is an island, and with its geographic location barriers, it is hard. It is a challenge for Fiji in terms of infrastructure. Getting most of these needed infrastructure in place in major health facilities, and the registries are outside of the main city centers. So these are some of the major administrative data digitization challenges that we are currently working on. And with the support of our partners, we hope that we will be able to have this addressed soon. So thank you for the question.
Thank you so much for your answer, Millie. And I think this is all the time we have for today for a Q&A. So thank you everyone for your questions. And yeah, thank you everyone for also joining today's Stats Cafe. In 2 weeks' times, we will have another Stats Cafe on CRVS, but more specifically on debt registration. So on the 23rd of February. And this Stats Cafe will look at different aspects of debt registration, like completeness estimates, gender dynamics, and country perspectives. So definitely there's going to be some great example of CRVS evidence generating projects or CRVS research during that session. So I highly recommend you to join us for this session as well. More information and registration to this event can be found on our ESCAP Stats Cafe webpage. So we hope to see you, in 2 weeks as well. Next slide, please. If you want to be updated about our future Stats Cafe or any other activities that we have at ESCAP related to statistics, I invite you to join our Asia-Pacific Collaborative on LinkedIn. So you can simply scan this QR code. We already have quite a few members, and it's a great platform for to learn or share anything related to official statistics in the Asia-Pacific region. Okay, next slide, please. Okay, so that's all for today. Thank you everyone for joining us today. Special thanks to all of our speakers today. So Tanya, Sana, Meli, and Nicola. And yeah, we hope to see you at our next session. So in the meantime, I wish you all a very good rest of your day. And goodbye, everyone.